And I look forward to working with all of my colleagues. As Mayor Lonergan mentioned, Senator Doherty and I, along with Senator Panaccio, introduced this bill today that is called the Healthcare Freedom Amendment. And it would amend Article 1 of the state constitution by adding a new paragraph to preserve the freedom for the people of New Jersey to provide for their health care. The new paragraph would read, "No state or federal law or regulation shall compel, directly or indirectly, any person to obtain health care coverage, any employer to provide health care coverage to its employees, or any health care provider to participate in any health care coverage plan or program." We are taking this step as a way to reject any potential national health care program that may be coming our way from Washington. We are doing so in response to a Congress that doesn't appear to represent the interests of the people of New Jersey. 35 other states have taken a similar step. They include Arizona, Florida, Michigan, Missouri, Ohio, and Pennsylvania. We want the freedom to decide to participate or not participate. We want what's called nullification, which has a long history in America. When a state nullifies a federal law, it is proclaiming that the law in question is void and inoperative or non-effective within the boundaries of our state, or in other words, not the law as far as the state is concerned. Early nullification movements began with the Virginia and Kentucky resolutions of 1798. These resolutions, authored by Thomas Jefferson and James Madison, asserted that the people of the state, as sovereign entities, could judge for themselves whether the federal government had overstepped its constitutional bounds. Virginia and Kentucky passed the resolutions in response to the Federal Alien and Sedition Acts, which provided in part for the prosecution of any person that criticized Congress or the President of the United States. Nullification was regularly called upon by states all over the country in response to everything from higher taxes to the Fugitive Slave Law of 1850. Besides health care legislation, activists and state legislators are pushing forward with nullification efforts all across the country, and it spans the political spectrum. 14 states now have some form of medical marijuana laws, in direct contravention to federal laws which state that the plant is illegal in all circumstances. The Healthcare Freedom Amendment is an important way of asserting the rights of New Jersey citizens to decide whether they want to participate in the legislative mess that's coming out of Washington in the form of health care reform. So we feel that it's an important step for New Jersey. We look forward to getting some co-sponsors of this legislation and getting it moving, and we hope that the public will support our message. And now I'm going to turn it over to Senator Doherty.